We are looking back now on the top 5 health stories of 2022. This list is in no particular order because we know these issues affect every Canadian differently. And to help us break them down, we are joined by Canadian Medical Association President, Dr. Alika Lafontaine. Welcome to Your Morning.
Thanks for having me.
It's a big list. Let's start with the ongoing COVID-19 pandemic. Where are we at with infection rates, variants, and the ever-adapting vaccines?
So I think this is the year that Canadians realize that this isn't a problem that we can walk past, it's a problem that we have to walk through. Public health conditions and guidelines probably still need to be implemented as peaks and valleys of these waves continue. We still encourage people to get their vaccines, to mask, stay home if you're sick. COVID will continue to weigh down the healthcare system. I think this year we also realized that with the ongoing variants that can occur through mutation as well as long COVID, we still have to keep an eye on the effects that this has on the population and the health of Canadians.
Next up, let's talk about this tridemic of RSV, COVID, and flu that's filling our pediatric hospitals. Why is this year so bad in particular for respiratory viruses?
For those of us in the healthcare system, this actually feels a lot like deja vu. Instead of this affecting adults, this is now affecting children. And so RSV, influenza, and COVID have all contributed to this triple endemic that is affecting our kids in fairly significant ways. Hospitals are being overwhelmed. Certain parts of the healthcare system have to be shut down and redistributed in order to deal with the acute spike. I think the reason why a lot of this is happening is because of public health guidelines that happened in the past that were so effective at mitigating the spread of these viruses. And so we can know that what's worked in the past can still work today. Continue to do those things that help. Continue to go to emergency rooms and other places for acute care if you need help. We will make it through this spike, and we do need to think about how to transform the healthcare system moving forward.
Your answer to that last question leads me to my next one. This is something we might see play out in 2023. You and other people in our healthcare field have been warning that our healthcare system is on the brink of collapse. Boy, we feel that on the client side as well. Emergency rooms closing, wait times are at record-breaking highs, hospitals are over capacity. How do you see this problem deepen over the past year?
I think there's two things that have become very clear in this year. The first is that our healthcare system is integrated and connected. So when we have problems with primary care, you can't get into a walk-in clinic or a family care office. You end up going to emergency rooms. And emergency rooms, once they're overwhelmed, you start to have problems with in-hospital admissions. Once ICUs get overwhelmed, you start looking to other places outside of the province. Also, we've realized that stress really travels downhill. We're seeing stresses within the healthcare system when it comes to funding that eventually makes its way to frontline providers and the patients who need care. So recognizing these two things really helps us to focus on where these changes need to happen. We need to make actions that change the state of play for patients who are trying to access care in this hard time.
Patients and healthcare workers, too, part of this system collapse is caused by staff shortages, which in part were caused by burnout from our healthcare workers. They've experienced this after being in crisis mode for the last couple of years. How did staffing levels change overall in 2022?
We knew that staffing levels were going to get worse as time moved on. We've been calling for a long time for increased training spots for both doctors, nurses, and other allied providers across the country as people retire and move on to different things. We know in the spike of demand and the fact that healthcare workers and their families are also getting sick is leading to the stresses on the system. So we've also realized this year that burnout is systemic. It's not individual. Working in these environments where you're constantly in high stress, where there's a lot of demand, that wears down on folks, and people are really on the edge of losing hope that things can change. And I think moving into the new year is an opportunity for political leadership in our systems to really transform the way that we work and bring that hope back.
Well, you're talking about stress trickling down. Let's go right to the top. There appears to be a lack of political will around healthcare. The premiers have met 3 times since July trying to get more help from the federal government. That meeting in Vancouver didn't have any real results to it. What progress has been made as you're looking ahead to 2023?
This year we've heard loud and clear from Canadians that they want to see the way that healthcare systems function to change. We've also heard this from providers. And so you've never had more unity than I can remember in recent memory, patient providers both calling for the same thing. What we're waiting for is for politicians to see this in their line of sight. The conversations that we're having about the Canada healthcare transfer and the funding of healthcare systems is important. What's even more important is that we make changes that are going to change how patients experience care and how providers experience working environments. That's going to make an impact on burnout and access to care.
I have one last question for you, Dr. Lafontaine. How can they not see it? How can they not see it when hospitals are calling in the Red Cross just to function?
When a tree falls in a forest, does it make a sound? I guess it depends who it falls near or who it falls on. And I think it's really clear that the stress within the system is falling on patients and providers right now. What I call to providers and patients every day is make sure you share your stories, get out on social media, contact your MLAs and MPs and other political leaders to make sure that they can hear that this is affecting you. I honestly feel that if we advocate together, we can make a big change that hopefully will start to have impacts in years to come.
Dr. Lafontaine, thank you for the work that you've done in this past year and for being with us today.
Thanks for having me.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.